over the last 100 years, international development has leveraged different underlying theories from colonialism to capitalism through different industrial revolutions and neoliberalism to a more people-centered and bottom-up development approach. In the 1950s and 60s, technology adoption was focused on supporting economic development by increasing industrial productivity. And the key lessons we've learned over the past 70 years was the need to adapt to cultural and societal norms of beneficiary communities and the importance of achieving a more appropriate balance between technology push and the need of end user communities. Within the last 20 years, there was a renewed optimism that technology could support sustainable socioeconomic development and the necessity of investing in both energy and communications infrastructure. As a follow-on to the Millennium Development Goals in 2015, governments around the world adopted the 2030 Agenda for Sustainable Development. The 17 UN Sustainable Development Goals provide a framework within which all stakeholders cooperate as part of a coordinated global partnership to support peace and prosperity by addressing key societal challenges, including universal access to education and healthcare. According to the Bantrand report, sustainable development is development that meets the needs of the present without compromising the ability of future generations to meet their own needs. Information Communication Technologies, ICT, is a horizontal enabler that, when resources are used appropriately, has the potential to act as a multiplier of available human and other resources. ICT for Development focuses on improving quality of life and accelerating social, economic, political, and employment opportunities in resource-constrained environments by adapting appropriate technology, good practices in areas such as agriculture, education, healthcare, and public service delivery to address the needs, aspirations, and capabilities of local communities. And important issues that we can consider when developing any ICT for development project include appropriateness and adaptation of technology. So, is the use of technology fit for purpose? Then the training requirements, skills transfer and change management, local ownership, sustainability, and potentially employment creation. UNESCO defines digital skills as a range of abilities to use digital devices, communication applications, and networks to address and manage information. And strengthening digital skills or digital literacy are necessary foundational prerequisites to enable locally owned, sustainable adoption of technological innovation. In my professional capacity, we have selected collaborative open innovation and co-design as the underlying methodologies when instigating interventions that will be leveraged and sustained by communities. So I'll now briefly summarize these concepts. So according to the OECD, innovation is the improvement of products, services, processes, business models, policies, and concepts in an existing context or their adaptation from one context to another with the goal of increasing performance or achieving another desirable impact. And then the concept of collaborative open innovation focuses on facilitating a pooling of innovative ideas from different stakeholder groups based on a trusting relationship to achieve a common goal that meets a specific defined user need. There are different types of innovation as outlined in the propeller. Technology innovation, business innovation, learning innovation, social innovation, and aesthetic innovation. And in reality, most interventions incorporate a number of different types of innovation. So at the preparatory stage, prior to engaging with stakeholders and end users from local communities, It's necessary for the intervention team to carefully consider what types of innovation are likely to be most appropriate for the environment within which it will be applied. So, for example, if an intervention is initially conceived from the lens of technology innovation, it also requires consideration of the potential intended and unintended social aspects to ensure it's socially and culturally relevant and fulfills a real community need. Aesthetic aspects to ensure ease of use and adoption. Learning aspects to support necessary skills and human capacity building in the context of facilitating lifelong learning. And business model and process aspects to ensure the potential for sustainability. So, when we are engaging with local communities, it's advisable to ask ourselves what types of innovation are most relevant for the end user community whose needs I wish to address and support. When we undertake a co-design approach, there's a requirement to engage with and capture inputs from end user communities as early as possible. And this covers all aspects. So, in terms of the requirement specification, the identification of potential implementation and sustainability challenges, identification of training and capacity building requirements, and agree on the most relevant technologies and approaches. Mechanisms for sustainability and employment income creation need to be designed into any ICT for development intervention. There's a requirement for local ownership, user-driven innovation, and skills transfer. So in the case of the Sakela Living Lab, which is based in South Africa, for example, the activities to be supported, which include a communications platform to support local community development activities for education and tourism, this was identified through a co-creation process with relevant stakeholders. And following deployment of infrastructure and technology applications in schools over 10 years, the community stakeholders were trained to maintain the network and maintain the applications. And this approach addressed end user driven, local ownership, fit for purpose, sustainability, employment creation and skills transfer, and this project continues as action research to this day. Training and skills transfer for different types of end users is a critical aspect to be considered from both the conceptual and planning stage. So if we imagine a health-related project, for example, the different user groups, so the administrators, the nurses, doctors, the community healthcare workers, and the patients, all engage with enabling technologies and tools in different ways, and they clearly have different requirements and different training needs to be considered. Sustainability and maintainability issues also require consideration of how to strengthen capacity within the beneficiary community or country to ensure necessary availability of local maintenance capacity and thus long-term sustainability. Consideration of appropriateness of technology requires a review of what adaptation is required based on the sociocultural and skills capacity related differences and the need for local ownership and end-driven innovation to achieve sustainability. So in many African countries, for example, hardware and software is often donated in good faith by donors without adequate consideration of whether they address local needs and whether there is local capacity to use, let alone maintain such technologies. So when we're looking at any possible technology interventions, it would be beneficial to undertake an analysis of the end user requirements and capabilities. Who are the local champions with the necessary credibility to engage with and motivate end user communities? What are the climate and the environmental issues, such as temperature and humidity, that would affect durability of the equipment? What is the availability and affordability of internet connectivity for web, or mobile-enabled applications or services. And then how do we ensure that the applications have sociocultural relevance? Who will maintain the necessary hardware and software? So between and even within African countries, there are sociocultural and religion-based differences in how people think about and address different issues that must be considered as part of the project design. User-centered design requires active involvement of end-user communities across all intervention phases. So from requirements, validation, and evaluation of iterative outputs. And ultimately, utilizing this type of systematic methodology is time consuming, and it requires flexibility from the implementing team to make the necessary changes in functionality and usability based on feedback from end users to ensure appropriateness and local ownership. However, its potential impact warrants this necessary consideration. When we look at the role of collaborative open innovation in community-driven interventions, it's necessary to consider all relevant innovation ecosystems. Based on studies that my colleague Paul and I have published, we've identified a broad range of key stakeholders to be considered as reflected in the diagram. Globalization, technological and social innovations have expanded the universe of contributing innovation stakeholders to include public, private, education and research, societal, international development and funding sectors, end user communities and innovation spaces, inside and outside national borders. Consideration of collaborative open innovation and co-design ultimately reduces risks associated with the potential of technology push. It informs the necessary sociocultural adaptation to facilitate community adoption, and it ultimately reduces technology and social innovation related implementation risks. And an interlinked methodology is action research. So action research is a participatory, reflective, cyclical, multi-stage methodological approach focused on achieving positive change to improve a social situation based on engagement with a specific community or group of stakeholders. As part of preparation, it's necessary to reflect on the social situation to be addressed and design clear goals based on active engagement with the local community and other relevant stakeholders. It's then necessary to plan the intervention, articulating the background and rationale and the appropriate methodologies for empirical data collection, data analysis and reporting. The third stage requires putting the research plan into action in the field with the participating community. And the fourth stage focuses on observation, including structured collection of and reflection on results. So, are the planned elements fit for purpose? What actually happened in the field? Intended and unintended consequences. Aspects that work well in practice and aspects that didn't. What needed to be modified to be fit for purpose in a real life situation with this specific group of stakeholders? And this analysis and reflection then feeds into the second cycle, where the methods may be redesigned, followed by implementation, observation, data collection, analysis, and reflection. And ultimately, the number of iterations in an action research project depends on the scale of the intervention and any adoption or training challenges that are identified in the field. Ultimately, the results, lessons learned, and good practices should be disseminated and communicated with the wider community to share knowledge and experience. In the context of ICT for development, humanitarian technology interventions, it's very important to share aspects that went well as what didn't go as planned, and how was this addressed, So this feeds into the body of knowledge in this domain and assists other teams working on technological interventions with local communities in the future. These are also important and necessary input to national policies so that local and national government can identify successful interventions that could be scaled at a local, regional, or national level, depending on initial results. So, having decided on the theoretical frameworks that are most appropriate, it's then necessary to consider ethical conundrums in the context of the proposed intervention, social and cultural aspects, and the types of stakeholders being engaged with, and the proposed types of technological innovation to be used. And so there are a number of premises that we can consider. So, for the sci-fi fans among us, we're familiar with Star Trek's Prime Directive. We shouldn't change the national order within societies or impose the use of superior technology, external values, or cultural norms. We have Asimov's Law of Robotics, Law Zero, which focuses on ensuring that humanity is not harmed. And we have the Asian tradition of being responsible for those that we interact with. So when we're interacting with local communities, the ethical conundrums that we need to consider include: when is it justified to change social norms by the introduction of technological innovation? What is the minimum threshold of development where the introduction of superior or transformational technology is warranted? What is the potential effect of the introduction of external values and new cultural ideas? Who should make these decisions, and who ultimately takes responsibility for the inevitable unintended consequences? When undertaking research, there are a number of clear research ethic principles that all master's students are introduced to that warrant adoption by all IEEE volunteers wishing to make societal contributions. So we as technologists need to follow research ethics when we're collecting data from people that inform a project or solution, when we're co-designing products, services, and business models with end-user communities or different stakeholder groups, and when there's a possibility that new intellectual property will be created. Research ethics require the intervention team to ensure that informed consent is in place. Participants in any type of an intervention must be clear about what data input will be used so they can decide if they wish to participate. They need to clearly understand the focus of the engagement, why they were selected, their role and any potential risks, how inputs will be used and how they will have access to the results, their level of anonymity, and their right to opt out at any time for any reason. It's necessary for the intervention team to ensure that informed consent has been recorded. So any project or intervention interacting with a local community should create an informed consent form. And if you as leaders in a project aren't familiar with this, I would suggest that you firstly go to your section and ask somebody to supervise this, an academic that has experience with informed consent. And if that type of support isn't available to you, then I would suggest that you contact the IEEE HTB staff and they will engage with the volunteers that are members of the board and put you on the right track. So informed consent should be recorded, there should be a signed form, and the copies should be given to both the participants and stored by the responsible lead researcher and volunteer. And ultimately, we need to ensure that the participants are protected. So participants in any intervention must be protected from any negative consequences or risks. We, as people working in the field, should avoid targeting vulnerable groups where possible, and vulnerable groups from a research ethics perspective are considered to be children, prisoners, the differently disabled, and people with serious illnesses. And as a lot of site and ICT for development projects touch on educational aspects, we need to be clear that children cannot provide informed consent, as people with diminished cognitive capability can also not provide informed consent. So for these two groupings, if there's any interaction, there must be approval from a legal guardian. And then a further complexity when we look at research ethics is depending on the laws in a specific country and the type of intervention planned, it may be necessary to seek ethical approval through an institutional review board, so that would be from an academic institution, or a national research board, which is run by normally a national council in the beneficiary country. And this type of formal approval takes time and needs to be planned into the intervention preparatory stage. So if you are not sure whether ethical approval is required, again, this is something in the context of being an IEEE volunteer, you should check with the section. And then if you need further support, come back to IEEE HTB staff. And we propose that ethical research principles are applied to all volunteer interventions to ensure that both local communities and IEEE at a high level and at a section level are protected, and there is an appropriate balance in terms of decision making between the implementation team and the beneficiary community. So in conclusion, when we're preparing an implementation plan for any community-based intervention involving IEEE volunteers, it's necessary to engage with the community during the preparation phase to identify clear objectives and a clear target audience. So we as technologists and engineers, we may imagine the most innovative solution from a technological perspective, but ultimately for the project to have impact and to be viable, we need to validate that that innovation is something that's actually relevant to the target group that we wish to interact with. It's important that we clearly communicate how the proposed objectives are relevant to the target community and how this has been validated. And that's one of the main touch points when you start preparing a site project. We need to demonstrate that the project objectives are relevant to the target community and demonstrate how this relevance has actually been validated. And there's two reasons for this. Firstly, it reduces the possibility of technology push or a potential solution looking for a problem to solve, rather than a true community intervention addressing a real societal challenge with technological innovation appropriate to the context. So in other words, how does this project address sociocultural norms? How does it take cognizance of existing infrastructure, existing skills capacity, and a well-defined end user group? And then, depending on the funding mechanism proposed, it may also be necessary to demonstrate how the objectives are relevant to and aligned with the aims of the funding mechanism identified. The implementation plan should outline a clear concept and approach, including the theoretical framework and the methodologies proposed to be used to support empirical data collection, analysis, replicability, and why this is fit for purpose. The plan should clearly explain what is innovative about this approach. How does it advance beyond what already exists in the environment that the intervention will take place? And how is it aligned with national policies? It's important to remember that any intervention not aligned with national policy is unlikely to secure the necessary level of national support to achieve long-term sustainability. So this is something that I would suggest strongly you consider at a very early stage. It's important to clearly state the expected impacts and how these will be measured. An impact assessment should use a clear methodology to facilitate generating credible results for dissemination so as to add to the body of knowledge in this domain. We need to bear in mind that unsupported opinions cannot be published and they cannot be validated. So if we don't have clear methodologies to collect data, it will be very challenging to publish results during and after an intervention. And when all these building blocks are in place, it's then possible to develop a well-structured implementation plan that can support the intervention team in realizing their vision. So key aspects that you could consider is looking at grouping the different activities involved in the project into what is research, what elements are development and adaptation, and how are we going to validate applicability and validate results. Identify clear activities and timelines for each activity and any interdependencies. Outline how engagement with end users has been realized in the preparation of the proposal and will be realized during the running of the project. It's critically important to identify implementation risks and mitigation approaches. It's not credible in a real-life situation that any project won't have implementation risks. So it's important at a very early stage that the intervention team clearly analyze what could all the implementation risks be, from low risk to high risk, and then what mitigation approaches do you imagine now could be put in place to mitigate these risks? And obviously this risk analysis is something you do throughout the life of a project. It's not something you do at the start and then tick the boxes at the end. It's a live part of your running project. As part of submitting a proposal for funding, it will be necessary to identify the team members involved, their different roles, and the complementary skills. Identify milestones and project outputs, and explain how sustainability beyond the initial project lifecycle will be realized. And then finally, consider what are the ethical aspects that need to be addressed. Do we need ethical approval? How will we address informed consent? And how is this going to be managed at a site level and at a section level? So we're going to briefly look at changes in the focus of global development over time from the perspective of leveraging technological innovation, theoretical frameworks that can be leveraged to support community-focused interventions, research ethics that need to be considered as part of the intervention design, and building blocks to support an implementation planning.